How long is someone contagious with bronchitis? We hear this question all the time in our clinic. The short answer is up to 3 weeks. But there are some caveats to that, so let me explain. If you want to learn about what causes bronchitis, how long someone is contagious, most importantly, how you can prevent getting or spreading bronchitis, then keep watching. First, let's talk about what bronchitis is. Bronchitis is an inflammation of the bronchial tubes, which carry air to and from your lungs. When these tubes get inflamed, they can become narrower, making it harder for air to move in and out of your lungs. This can cause a number of unpleasant symptoms, including coughing, wheezing, and difficulty breathing. Bronchitis can be acute or chronic. Acute bronchitis is a short-term condition that usually lasts a few days or weeks. It's often caused by a viral infection, but it can also be caused by bacteria, irritants, or other factors. In most cases, acute bronchitis goes away on its own with rest and fluids. However, if you have a chronic illness such as COPD or asthma, you may be at risk of complications from acute bronchitis, including pneumonia, which is an infection of the lungs. So it's important to see a doctor if you develop these symptoms, especially if you have a chronic illness. Chronic bronchitis is a long-term condition that lasts for months or even years. It's usually caused by exposure to irritants such as tobacco smoke, pollution, or dust. Chronic bronchitis can lead to more serious problems such as emphysema, which is a disease of the lungs, and respiratory failure. If you have chronic bronchitis, it's important to see a doctor regularly to monitor your symptoms and make sure that you're taking the right steps to manage the condition. Now that we know what bronchitis is, let's talk about how it spreads. Bronchitis is typically spread through respiratory droplets released when an infected person coughs, sneezes, or talks. These droplets can land in the mouths or noses of people who are nearby, or they can be inhaled into the lungs. You can also get bronchitis by coming into contact with contaminated surfaces or objects, such as doorknobs or toys, and then touching your mouth, nose, or eyes. Some types of bronchitis are contagious and some are not. Viral bronchitis is the most common type of bronchitis, and it is contagious. This means that you can spread the virus to others even if you don't feel sick. Bacterial bronchitis is less common than viral bronchitis, but it is also contagious. If you have bacterial bronchitis, you'll likely feel sick and have a fever, cough, and difficulty breathing. Chronic bronchitis is not contagious. This type of bronchitis is usually caused by exposure to irritants, such as cigarette smoke, and it's not caused by a virus or bacteria that can be spread to others.
Ow.
So the next question is, how long is someone contagious with bronchitis? That depends on the type of bronchitis. People are most contagious with viral bronchitis during the first week of illness, before the cough has subsided. Some viruses that cause bronchitis can be shed for up to 3 weeks. With bacterial bronchitis, people are contagious until they've been on antibiotics for at least 24 hours. With chronic bronchitis, people are not contagious. There are a few things that can increase your risk of getting bronchitis. These include having a weakened immune system, smoking, and exposure to secondhand smoke. If you have any of these risk factors, you should take extra precautions to protect yourself from bronchitis. Now, let's talk about symptoms. Bronchitis can cause a variety of symptoms, including coughing, wheezing, difficulty breathing, fatigue, fever, chills, sore throat, runny nose, and chest pain. If you have any of these symptoms, it's important to see a doctor. Now let's talk about treatment. Treatment for bronchitis will depend on the underlying cause. For example, if you have bronchitis caused by a viral infection, your doctor may recommend that you get plenty of rest, drink fluids, and use a humidifier. If you have bronchitis caused by a bacterial infection, your doctor may prescribe antibiotics. There are also a number of over-the-counter medications that can help relieve the symptoms of bronchitis. These include cough suppressants, expectorants, and pain relievers. Now let's talk about how to prevent bronchitis. There are a few things that you can do to help prevent bronchitis. These include washing your hands frequently, avoiding close contact with people who are sick, covering your mouth and nose when you cough or sneeze, and staying away from tobacco smoke. When should you see a doctor for bronchitis? It's important to see a doctor if you have bronchitis because it could be a sign of a more serious problem. This is especially true if you have a chronic illness like COPD or asthma. You should also see a doctor if your symptoms are severe, or if they do and improve with home treatment. There are some signs and symptoms that indicate your bronchitis may be getting worse, and you need to call your doctor right away. These include difficulty breathing, shortness of breath, wheezing, and a persistent cough that produces green or yellow mucus. If you experience any of these symptoms, don't hesitate to call your doctor. It's always better to be safe than sorry. Let's go back to the original question. How long is someone contagious with bronchitis? The answer is up to 3 weeks. But there are some caveats. Contagiousness depends on the type of bronchitis. People are most contagious with viral bronchitis during the first week of illness before the cough has subsided. Some viruses that cause bronchitis can be shed for up to 3 weeks. With bacterial bronchitis, people are contagious until they've been on antibiotics for at least 24 hours. With chronic bronchitis, people are not contagious. We hope this video has answered your questions about bronchitis. If you have any more questions, please leave them in the comments below. We'll be happy to answer them. If you want to learn more about bronchitis, check out the resources we've linked to in the description. Thanks for watching. And now let's move on to the next video. How long does it take for a fever to go away? When should I worry about a fever? What are the different ways a fever can be harmful? You'll find answers to these questions and more in our next video. Remember, stay healthy, stay informed. See you next time.